really liked seeing the patients make gains really quickly. So in a facility like this, often patients come in really quite debilitated, needing a lot of assistance. And then really within sort of 2, 3, 4 days, you can really see those big improvements. And I feel that's really quite rewarding, so that's why I enjoy it. At Bayside, we offer a 7-day service. So what I've found at other facilities is you do a lot of work during the week. Patients do a lot of rehab Monday to Friday, but then when the weekend rolls around, they have a couple of days off and they take a little step backwards over the weekend. Whereas here, our therapy continues the whole way through, so patients will get seen Monday through Sunday. Yeah, we see a lot of orthopaedic patients, so a lot of patients after knee replacements or hip replacements or shoulder replacements. So that's sort of the bulk of our population group. We also see a lot of patients who are sort of just the older patients who have been in hospital for a while or had a medical procedure or a minor surgical procedure or spent a bit of time in hospital who just need a bit more time to get back on their feet. The first one's usually how long will I be here for, which we usually find patients will stay. It really depends on how well they're progressing, but it's usually between around the 7 to 10 day mark. Other questions we often get would be what happens after I go home from rehab. So all our patients after they go home would be set up with a home exercise program with some additional therapy to do at home. And if they require it, they'll be linked in with a physio in the community where they can either come back here or head to another physiotherapist where they can keep going with their therapy. Probably my biggest tip would be look around at the facilities that the rehabilitation place offers. So go and check out the gym, go and check out the ward and ask some questions about how much therapy you'll actually be receiving. I think one thing that sets us aside at Bayside is the amount of therapy you'll get each day. And I really think that's really important to getting a good outcome. Whether you've had a hip replacement, a knee replacement or just been in hospital for a while, those first couple of weeks after surgery could be really quite crucial to having a good outcome down the track. So that's what I'd be looking for.